by sending my heartfelt sympathy to the students, staff, families, and everyone in the Austin East community. We are grateful to everyone who is working to support this incredible community and promoting healing through these challenging times. And now we'll bring up our vaccine information page for some updates. There have been more than 270,000 vaccines administered to Knox County residents, and more than 37% of Knox County residents have had at least one dose, giving them some level of protection against COVID-19. This is great progress, but we are beginning to see demand wane, which is not surprising, but it slows our progress in getting past this pandemic. This could be for a variety of reasons, such as some folks are just too busy. It may not be a priority for some. Some still have some unanswered questions, and some may have some very serious concerns or overall hesitancy. Please remember that if you're unsure of whether you'd like to take the vaccine, to have a discussion with your medical provider. Recognize that there is a great deal of misinformation online and especially on social media. So please be cautious and make sure that you're making your decisions based on factual information. This is one reason why it's so very important to discuss any questions you may have with your doctor. For those who may feel like they are healthy and young and not at risk, please remember that getting the vaccine also helps protect those around you and does help slow the spread of this disease. And it really helps us to get out of this pandemic. So please consider getting vaccinated as soon as you can if you haven't already. I also want to take a minute to discuss the announcement from the CDC and the FDA regarding pausing the distribution of the J&J vaccine. I want to emphasize that the pause is evidence of the incredible safety standards of the COVID vaccine program that we have here in this country. The CDC and the FDA are investigating 6 cases out of over 7 million vaccines administered. And while they are serious, it is still just 1 in 1 million that they've actually over to that they've taken, and they've taken a significant move and are investigating any possible link to. It just demonstrates the incredibly high standards that we have. As a part of the safety standards, the FDA has requested that folks who have received the J&J vaccine, who develop severe headache, abdominal pain, leg pain, or shortness of breath within the 3 weeks after getting the vaccine, that they should contact their provider. We also want to reiterate that the Pfizer and Moderna vaccines utilize a completely different technology and still are widely available. And again, encourage folks to please go ahead and get that vaccine as soon as they can if they haven't already. We'll now move into the local situation. As a reminder, all of this data, including our benchmarks, is available on our website at covid.knoxcountytn.gov. We have 51 new confirmed cases since yesterday's report. 768 are active cases. 32 Knox County residents are currently hospitalized. And fortunately, we have no additional deaths to report today, keeping our total at 623. And now we'll review the weekly benchmarks. The first benchmark is sustained a reduction or stability in new cases for 14 days. In the past 14 days, the average number of cases per day was 43. And in the past 7 days, this number was approximately 37. This data is headed in the right direction, but we want to see this continue to decline. We always talk about we want to see a trend. Therefore, this benchmark remains yellow. Please continue to follow the 5 core actions, not letting those go, and get vaccinated so that we can continue to see these numbers decline. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding lab turnaround time, this figure remains less than 2 days on average and has been under 2 days since the beginning of February. For the volume of tests, we saw another decrease, over 3,900 tests the week before to 3,700 for this reporting period. And because of these factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. We changed this benchmark slightly this week. The goal remains to increase overall vaccine distribution across the county. Since the change in the amount of vaccinations administered among Knox County residents from week to week may plateau or even decline over time as a percentage of vaccinated residents grows, we are adjusting this benchmark to include the percent of Knox County residents who started vaccination and the percent who are fully vaccinated, as you see here. We think this is a more clear representation of what's happening within the community. The goal is to see continued growth in both of these percentages over time until the point at which the state and federal public health experts deem it is safe to resume pre-pandemic activities. Due to the improving trend, we are representing this benchmark as green. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. Over the past week, we have seen a slight increase in the number of hospitalized non-COVID-19 patients. The number of COVID positive patients has held steady, and we'd like to see this decrease. However, we do want to reiterate that the hospitals are still within their capacity. After speaking with our hospital partners, they have recommended that this benchmark continue to be green. And our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. We also updated this benchmark. The White House Task Force report determines a green standing based on 0 deaths per 100,000. However, due to the nature of COVID-19, 0 deaths per 100,000 population may not be feasible at this time. So we are proposing a metric that includes a low death rate, which is 0.5 deaths per 100 population, or that works out to be about 2 deaths per week, which are still we do not want to have. We want everybody to continue to follow the 5 core actions, but for this benchmark, that's where we're setting it. There have been 2 deaths reported in the past week, which is a rate of 0.43 deaths per 100,000, and the information available leads us to represent this benchmark as green. Under our supplemental data section, the first chart shows new daily cases per 100,000 population. As of yesterday, our 14-day trend line showed 9 and 8 new cases per 100,000 respectively, both of which have remained fairly consistent. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 8.07%. And you can see that overall, that's a pretty standard metric that we've had recently as well. Now, before I open it up for questions, I want to discuss something that's concerning. I'm troubled by the narrative so often presented today that there is equal data on both sides of some of the medical recommendations. And folks have even used this narrative to dismiss medical guidance that they don't like or personally disagree with. While the scientific community continues to learn every single day about COVID-19 as they would with any new virus, some things are now a closed case because there is now a body of evidence, an entire body of research and consensus among experts from across the world. When making important public health recommendations for an entire population, it's critical that medical and public health professionals look for the scientific consensus, or in other words, the most common or duplicated findings, which we have now after a year of being in this pandemic for a lot of the recommendations or all of the recommendations that are out there. So as I close out today, with everything going on with the pandemic and in this community as a whole, I want to reflect on the tools that we can use to help us navigate through the noise and misinformation that is all around us. We have a wonderful nationally award-winning series on our website called Webidemic that was developed well before the pandemic because unfortunately misinformation is not a new problem. It talks about what to expect, about how communications and knowledge can change through a disaster because we learn more and information changes and we implement new things. That can lead to changing guidelines until we have a body of evidence to drive those recommendations. It discusses how it's important to look for credible resources and the value that should be placed in consensus or in that body of evidence that we've discussed today. All of these tools are invaluable in these times with so much misinformation. This pandemic will end, and we believe that things won't always feel as divided as they do now. And it is my hope that these tools that I mentioned today can be useful for all of us when the next issue or crisis is before us. And now I'll open it up for questions.
All right, our first question is from Brian Hornback. With this being the last scheduled media briefing of the pandemic, is this an indication the pandemic is over?
No, it is not. These briefings are just one of the tools in our toolbox for communication. And we do feel like we're at a point where we can step back from these, but we will still continue putting out information and guidance every day related to this pandemic. That will continue. We will continue to answer media questions. We'll continue to be available for interviews. We're really just trying to get back to some of our pre-pandemic ways of communicating with the media at this point. I think it is positive that we feel like we're at a place that we can do this, but by no means does it mean that the pandemic's over. Again, continue to follow those 5 core actions. Please get vaccinated as soon as you can. And that way we can get out of this even faster than the pace we're going right now.
And this is similar to Brian's question. Justin from WATE. With this being the last briefing, what does this say about the state of the pandemic in Knox County? And are you concerned that this might send the wrong message that the pandemic is over?
No, we hope that this doesn't send the wrong message. We really want to consider where we are with the pandemic. We have been making improvements. Again, we are going to continue to use all of the other tools in our toolbox to communicate with the public. And we will continue to put out information and answer questions moving forward. But I do think we need to acknowledge that we are in a better place than we were previously, and we want to continue to move forward and continue to make the progress that we've been seeing.
Paul with WBIR. I haven't had the opportunity to ask my marathon question.
I knew it was going to come.
This is a marathon. What mile marker are we on?
You know, it's hard to say. A lot of it's going to depend on what happens over the next couple months as far as people's behavior and the 5 core actions and variants and vaccine. But I feel personally, and I hope that we are at the back end of that marathon. It's when we're starting to get, I haven't run a full marathon, I've run a half marathon. And at the very end, you know, when you hit mile 11 or so for that half marathon, I felt that's when my energy starts coming back. Mile 10's the hardest for me. And mile 11, mile 12 that's where the energy starts to come back because you can see that finish line. And I think that we really need to continue to move forward so we can get to that finish line as fast as we possibly can.
All right, Justin with WATE. Last week, Knox County benchmarks went from 4 yellows and 1 green to 2 yellows and 3 greens. Things seem to be trending worse to trending better. What changed over that time?
I thought we were at all greens and 2 yellows right now. I'm a little confused. Okay. Am I correct on that?
I think you may be asking about
the previous 2 weeks?
Yeah, and so
Gotcha.
It's not, Justin, if we're mistaken, please just enter that into the chat box, the feature,
okay,
and we'll correct it.
Again, I think that's the nature of the pandemic. I think that's the very reason that we don't look at one data point. We don't look at one single day, that we want to see trends. And that we've talked about that the whole time. And so trends help us really have a better idea of the direction we're going. And I think that kind of up and down that we're seeing is a lot of what we're seeing along the lines of being in a plateau with with our cases and with our hospitalizations and such. And so again, I know I'm saying it over and over again, but we can't let off the gas. We need to continue doing all the things that we know that we can do to prevent the spread of this disease. So that we can continue to make progress. We want to see all of those trends going down as we move forward.
All right, Justin again with WATE. Will the loss of the Johnson & Johnson vaccine have much of an impact on vaccine availability in Knox County? And are sufficient supplies available to providers?
Yeah, supply at this point, and I believe the state's talking about this as well. The supply is outpacing demand. And so we don't really foresee any issues with the people that want to get vaccinated being able to have access to get vaccinated with the Moderna, the Pfizer vaccine. So we are not expecting to see any challenges with the Johnson & Johnson. It was relatively new coming in with our supply anyway, and it wasn't the bulk of our supply.
All right, Vincent with Knox News. Will the benchmarks, vaccine data, and pandemic data be updated going forward?
Oh yeah, we will continue to update data and do all of the other things that we've been doing. It's just these routine briefings. And we'll have a briefing if we need to, if something else pops up as well. I do want to reiterate that J&J is not gone, it's on a pause. It's still there. So once everybody finishes the, cycling back to the last question, sorry. So once FDA and CDC and all of the experts review evidence and put out new guidelines, we'll be revisiting those as well. But there's still vaccine available, plenty of vaccine available.
All right, Justin with WATE, what do you tell people who have concerns about the J&J vaccine, specifically those who have taken it already?
You know, I think that what we hit on is the request, if the folks are having any of those symptoms we talked about at the beginning, the severe headaches, leg pain, things of that nature, to have a conversation with your doctor. But I'm going to go back and say that it's been 6 people and over 7 million doses that have been given at this point. And so the vast majority of folks have not seen this issue. And it's and so just, you know, as always, be aware of your personal health and what your body's telling you. And if you have concerns, visit your doctor.
Another question from Justin with WAT. How long are the J&J vaccines still good since they are on hold at this point?
I do not know the answer to that, and we will have to get back with you. We can tell you what the expiration date is for the ones that we've received, but I can't give an overall answer. Yeah, as long as they're stored safely, which we will continue to do as well. Dr. Buchanan just pointed that out as well. But we'll have to get back with you for what our time frame is for the vaccine that we have.
Are you still, and this is also Justin with WATE, are you still seeing vaccination hesitancy?
You know, there's a broad spectrum there for everybody. There's the, you know, gung-ho, I want to be first in line to get my vaccine, to the people that are going to always be concerned and not get it. And there is a broad spectrum, and we are seeing that. It's to be expected. And again, we encourage that folks talk with credible sources to get information as they're trying to make decisions on their health, and that includes the vaccine. So talk with your doctor. Look at, you know, what the FDA and the CDC is saying. If anything, I want to reiterate that people that are concerned about safety of vaccines should really take to heart how serious I think it's been demonstrated that this country is taking the vaccine safety program with what's happened with J&J this week and with the pause. And so have those conversations and please consider getting vaccinated as soon as you can.
Vincent with Knox News, are you seeing any group in particular as a hotspot of vaccine hesitancy?
You know, there's been some coverage. There's a lot of different, again, it's a spectrum. There's a lot of different folks. There has been discussions with people that have historically had vaccine hesitancy questions and concerns and that have always been there. And then there's some other pockets in the population that have been demonstrating that as well. And there's some studies and I think some recent reports out there from that we want to address. And so we're talking through how that we can continue to try to reach out to folks that are maybe having second thoughts and who we can push and encourage them to talk to get guidance. And again, everything that we're seeing as far as the evidence on that really says that folks that are hesitant rely on what their provider says. And so that's why we're pushing that message pretty hard, that we really want those folks to talk to their doctor.
All right, Vincent with Knox News again. I know this was addressed particularly in an earlier question, but how, in your estimation, does it look when a pandemic ends?
Wow. I don't think we're going to have a day. That's the end of the pandemic day. I think that Dr. Reed's got something for me, but to help me out. But I think that, you know, there will eventually be some declarations from the CDC and the World Health Organization. But I think we're also just going to hopefully see our vaccine numbers going up. There's also something to be said that the more people get vaccinated and they can talk to their friends and their relatives and their loved ones, and that they haven't had issues, that they'll we'll hopefully see vaccine increase and our case numbers will go down. And those national experts and the international experts we've been looking at will help us to determine what that endpoint is at this time. So much of it is reliant on, again, people's actions, behaviors, and the virus itself, vaccine, the the 5 core actions, all of those things. So it's really hard to say.
All right, if there are any more questions from the media, if you'll please enter those into the chat feature. Someone is typing, just 1 second.
Okay.
Vincent with Knox News. Just individuals' actions or the actions of policymakers and leaders? That's the question.
Is that in relation to the previous
I
question?
think that's in relation to your answer that you provided, but Vincent, please clarify if we are mistaken.
So say that one more time. Sorry.
You said it was on people's behavior, and he said just individual actions or the actions
Oh.
of policymakers and leaders.
I think it's everybody. I think everybody, we all need to be on the same page as far as continuing to follow the guidance and the science and the data that's out there to help us get through that and get through this pandemic. There's relying on the actions of the virus itself. But we really want to encourage everybody, our policymakers, the public, everybody to be moving forward in the same direction, following those 5 core actions and getting vaccinated so that we can get to the end of this. I hope that helps.
All right, one last call for any more questions. Brian Hornback says, thanks for being able to answer questions for the last 13 months. I look forward to helping with all your other information going forward.
Thank you.
And then some thank you. So thank you very much.
Yeah, and thank you to all of you for being here with us through all of this for the last 13 months and helping to get information out and asking us the hard questions when we needed to be asked those, and for being a part of the team with us. Thank you.
Just some more thank you. So thank you to our media partners on the call and out there, and thank you to everyone else who is watching, and we look forward to talking with you in many different platforms moving forward.